Breast milk is the food of choice for infants, but between the ages of 1 to 2 and even sometimes before that, infants need to start eating more food to meet their caloric demands every day. So when babies are still nursing between the ages of 1 and 2, it's usually more of an emotional attachment, which can make it more difficult to wean the baby from nursing. The trick is to get your child used to something else during the normal nursing times. For example, if your baby's wanting to eat at certain times during the day, you need to replace a nursing session with something that's going to distract your child, like giving your baby a cup of milk, or playing a game, or doing something else to engage them that will help them forget about the nursing session. And also, it's helpful if mothers do things like not assume the nursing position, wear different clothes, like maybe you could just do away with your nursing bra, and once if your baby tries to pull at you, then they'll figure out that that's not really there. It's not an option anymore. And it's really just going to take time. You just need to decide when you want to wean and just do it and be persistent about it. Because if you give in consistently, then your baby will learn that, they'll get a little bit confused and think that sometimes it's okay to nurse and other times it's not. But for your own benefit, if you're still weaning or if you're still nursing on a regular basis, it's best to wean slowly so that you avoid things like clogged milk ducts and mastitis. So if you're regularly feeding your baby a few times a day, then just start cutting out one feeding every 2 to 5 days and slowly wean down to no feedings. And again, that will reduce the risk of complications with you. As for nighttime feedings, most babies who are 17 months old don't need nighttime feedings unless they're underweight. So I recommend first talking to the pediatrician and seeing if your baby requires these extra feedings. And if not, and there's no other medical conditions behind your baby waking up at night, then you need to teach your baby how to self-soothe, and that will help eliminate your baby's desire to wake up at night and want to nurse, because really what it comes down to is your baby just wants you. So if you teach your baby to self-soothe, then you'll all probably be getting more sleep. So we're going to post an additional video that you can watch that will tell you how to teach your baby to self-soothe, and I hope you're all getting better sleep soon. And if you have any other questions for me, feel free to ask them on our Facebook page, and recommend us to your friends and family too.